Hello, my name is Dr. Max Greig. I'm an orthopedic surgeon in Puerto Vallarta, Mexico. We take care of a lot of Canadians and Americans that come down here for their knees, hips, shoulder, and back problems. One of the most common joints that get affected is the knee. Once the cartilage wears out, then a person has a situation where it's bone on bone. You can see on this graphic here how you can see normal cartilage and cartilage that has worn out, and it can get down to be bare bone, similar to what you can see in this model. Once it gets to this point, then a person has difficulty walking and getting around. So what do we do for it? Well, we are able to put in what we call a knee replacement. That's formed by this femoral component, a tibial component, and this insert. And when they assemble, assembles the knee again. So this insert will last for many, many years and resemble that cartilage that you have lost. And once you have a new knee, you're able to go back doing the things you love to do.